Yes, good afternoon, everyone. Once again, we are live here in Real Talk. Of course, with our MNA, David Birnbaum. And let's welcome him right now. He is on the line. Ayan. Good afternoon, Sir David. How are
Good
you today?
afternoon. Very well, Norberto. A real pleasure to be with you, even if it is at this very difficult time.
Okay, let's go to the first question, sir. How's Quebec right now in this pandemic?
Well, you know what? Like everything else we're dealing with, there are some very dark clouds and some stories of courage and heroism as well worth noting. And Quebec is in both camps. I think we should all, in our diversity, be very proud of how collectively we have responded to something the world's never seen. I mean, one can't underestimate how profoundly serious what we're dealing with is. And Quebecers' response over the past 5 weeks has been quite something. Together, think of what we've done. We've changed how we live. We're following very serious public health directives requiring that we stay inside, that in many cases we not see our loved ones, our own adult children, our parents, sometimes who are sick. We've stuck together, and despite the tragic numbers, you're looking at substantial deaths and so many families touched by this. I do think that because we've handled things quite well together, we have limited the tragedy, but we've got some tough times still ahead of us.
Okay. And what are the numbers right now? It is keep coming up or going down at this time?
Yeah, well, it's complicated, and I hope that whenever possible, your listeners are following the news conferences. It was a bit frustrating for us in the early days when there were no official comments made in English. I, through our leader Pierre Lacan, intervened, and you saw on about day 8 that the premier started speaking formally in English at each news conference. But most important, those daily encounters, we're not in a partisan environment now. We have to be all working together. Those encounters are important because they give you the clearest story on what is happening each day. Your audience will know that today there was the important first announcement about reopening our schools should things stay calm and so on. Some very important questions about that. But the key information, I think, comes during those daily news conferences of the Premier, the Health Minister, and the Director of Public Health, Dr. Arruda. And I don't have the numbers in front of me, but obviously they're very serious numbers. We're very close to 1,500 deaths, and probably more than 10 times that in terms of active cases. So the situation is serious. I guess, and here there are so many in your Filipino community who work in the health sector, who are on the front lines, and I salute all of them. So many who would understand the different dynamics of what's going on. On the one hand, and again, I want to take a second to salute so many in the Filipino community who are at the eye of the storm, who are working in seniors' long-term care residences, CHSLDs as they're known, that are absolutely at the eye of the storm. But those workers, like many of us, will understand, again, that there is some promising news and there remains worrisome news. Promising news, first of all, we're all Quebecers, we're all Canadians. If you look for just 1 second beyond the real tragedy, frankly, that our seniors are facing, if you do look at the rest of our society, at our children, at the adults in the community, the numbers are flattening. That infamous curve is flattening. It's so sad to look at the number of people who are losing their lives. It is important to note that I think it's about 90% of them are seniors, and in most cases, seniors who were very sick and were so already. What that means is that huge and important problem to each of us has to be fixed, and we're not there yet. but it does also mean that the rest of society is a little closer to seeing the light at the end of the tunnel. So that's why you're hearing, we have some questions as the opposition, but that's why you're hearing that necessarily we do have to be talking about how we try to get back to normal at the same time.
Okay, sir. And sir, question: how we can protect our caregivers or our frontliners? That's the most important question at this time.
Well, and again, I remember with respect how many people in our Filipino community are active and courageous participants in the health sector, and they know they're going home to their families, and they know how crucially important it is that their heroic work during the day not somehow tragically have the adverse effect and making things worse when they get home with their families. They know that it's so important that they be in protective equipment when they're at work and exposed to patients who are positive, and that they leave their clothing there and they come home and they're absolutely clean and careful. They know that if anybody has symptoms and has tested positive for COVID-19, they have to be isolated, even from their most loved ones. They know that. For the rest of us, I'm working from home. I'm over 60. I'm very much limiting my outings. I'm part of a slightly higher risk group because I've got ulcerative colitis, which is an immunosuppressive disease. So I've got to be extra careful. But all of us, those of us who are over 70, it's really tough. Have to be absolutely limiting our outings. Everybody should be maintaining the 2-meter distance rule we always hear about. These things, they're not matters of opinion. They're matters of protecting ourselves. I mean, you see in some countries, just to the south of us, some movements that I just find deplorable of people saying, well, don't take my rights away. I have the right to work and hug whoever I want. That kind of sentiment is just crazy. You're costing lives. So it's so important that we all protect ourselves. And look, we're all getting good at it. It's not fun, but I hope and I think in most cases, people who need it are getting help to get their groceries. Our seniors have, we hope, loved ones, neighbors around who are allowing them to stay isolated as they have to. It's not a normal time, and it's really important that we obey the rules.
Okay, sir. And it's another thing, sir. Here's some questions that are here in given to us by some of our listeners. Uh, okay, is there a unified rules or regulation for residents for those who are under self isolation caregivers?
Sorry, who are under self-isolation?
Yeah, is there unified rules and regulation for residents for those who are under self isolation caregivers?
Yeah. Yeah, two things, I guess. First, many of you will have noted that there was a major, excuse me, a pamphlet on how to take care of oneself at this difficult time that was distributed by the Quebec government. We were very disappointed that it was distributed only in French, but it's available online. And Norberto, if it's helpful, you might, I'll get you the link which you can post. The pamphlet is available in English online, number one. Number two, I've worked very hard. I'm awaiting copies in English that I can distribute to people who need them.
Okay.
But I do invite, Norberto, perhaps you can give our phone number later. I do invite residents who need that pamphlet in English to call our office. We're all working from home, but we're checking our messages, and give us your mailing address. We'll get you that pamphlet in English. The short story, and I don't want to pretend I'm from public health, so I won't go into too much detail, Norberto, you'll understand. But again, the basic rules are really important. You have to wash your hands and thoroughly and almost obsessively. Obviously, we all know to do that after we've been in contact with a dirty substance or whatever. But now, when if you bring home your groceries, if you're shopping on your own, or if you have groceries delivered, many people are actually washing each package. That is something that many are doing. I'm not the expert on that, but for sure, when you put those groceries away, you wash your hands. You absolutely keep your distance. If you're in a household and you've tested positive, and the other members of your family so far are safe, then the strictest possible isolation has to be employed. You should probably be wearing a mask, if not other protective gear, and in no contact, not exchange any objects with anybody in your family. So I don't want to replace any doctors, but the most extreme care is the rule of the day. This is not a kind of virus we've seen before.
Mm. Anyway, sir, we will touch this because I always listen to the press conference of the of Franz Salago, even though there's no English on it, and if he speak in English just a little, but I understand a little bit. So I'm just asking because they were calling the armed forces to help for the seniors, but
Yeah.
uh, is Quebec aware that there are almost 2,000 nurses came from other countries, specifically in the Philippines, came here in Canada, especially in Quebec? They are not aware for that because they're calling military to help.
Yes.
Are they aware?
Yes, this is very frustrating, and we've made the point a number of times, and I'm told that things are getting a bit better. The best advice for people in the community who have skills is to get on the site, and again, we'll get you the link. Je bénévole, I volunteer,
Uh-uh.
and the premier uh, emphasized even more clearly last week that anyone with skills, maybe even if they don't have all the direct skills to work in a seniors home care facility, a CHSLD, they are welcome if they are ready to work full time. And don't be thrown off by the name of the site, I volunteer. These are, of course, paid positions. And in the current emergency circumstances, they pay more. So members of the Filipino community who are ready to get to work should get on that site. And like I say, when we're done, Norberto, I will make sure my office supplies you with the websites. We are told, and we keep pushing,
Okay.
we are told that Ministry of Health and Social Services officials are now looking really carefully through that list of every name again and
Uh-huh.
making sure that people, like I'm sure so many in the Filipino community who can help out at this difficult time, are given the chance to do so. And like I say, those are, of course, paid positions.
Okay, sir. One last thing, sir. We have an online to ask you a question. He can ask you a question directly. And go ahead. Hello. Go ahead. Oh, why she was. Where are you? Hello. Can you? Okay. Maybe he was out. I don't know. Anyway, probably that's all for now, Sir David. Thank you so much for your time. I will not hold you for long because I know you're a so busy man.
Thank
And
you. Can I make just one more point or two? Just because I wanted to, I'm so pleased to have the opportunity to talk directly to the community.
yeah.
Have you got 2 more minutes? I just wanted to
Yeah,
mention
okay,
two
okay. It's okay. It's
things.
okay. You have time. You have time.
Okay, thank you, Norberto. Two things. One, first of all, I want to commend you, and then I'll get to a reason that you'll understand. People like Norberto are absolute lifelines at this point, right? When we're trying to get information about difficult situations, I know you are always answering the call, Norberto, and you're there for your community. So I really do, first of all, want to commend you for your work.
Mhm.
Second, I want to note that one of the privileges of being an MNA is that we have limited funds that we can use to help people out in trying and difficult times. And I'm really honored to have been able to help FAMAS and some
Mhm.
other groups in the Filipino community who are offering emergency food relief and so on. So
Mhm.
we've done what we can to provide FAMAS with $7,500 in help for their food relief efforts, and we'll keep working for more. The second thing I want to let you and your listeners know about, and I invite you to contact me if you have ideas.
Mm-mm.
Each day over the next 30 days or so on my Facebook site,
Mm-mm.
I will be honoring local heroes, people who in the Filipino community and in our English and French speaking communities, the Tamil community, the Black community, who are going above the call of duty at this very difficult time. And not only will I honor those individuals, I've teamed up with somebody some of you might know about, who's a wonderful man, Mitch Garber. He's the president of the board of the Cirque du Soleil, a local, a very successful businessman and very proud Quebecer and Canadian. I texted Mitch, and he got back to me within 20 seconds. I asked him if he would donate $500 to every one of those organizations that those 30 local heroes are helping out, and he said yes. So I want to honor people in every community. What I would invite you and your audience to think about, if you know of someone, they might be a caregiver in a long-term care facility, they might be somebody delivering groceries to seniors, they might be someone reaching out through the Filipino media. If there is someone that we should properly honor in your Filipino community so that the entire Facebook community gets to see it, and an organization perhaps in the Filipino community receives that donation from Mitch Garber, I would be thrilled to honor an individual. So I invite you to have your audience participate in this Local Heroes site, and they can do so by looking on my Facebook website or phone my office at 514-488-7028.
Okay, sir. Thank you so much for your time, Sir David. I know your time is so precious, especially at this moment. Thank you so much, sir.
Norberto, a pleasure. My very best to everybody. Stay safe.
Okay, sir. Thank you so much.
Thank you. Bye-bye.
Thank you so much. Bye-bye. And that's it. Sir David Birnbaum, the member of National Assembly for D'Arcy-McGee. And that's all for now. This is your very host, BGU. We Real Talk with David Birnbaum. Thank you.